Hello students, welcome to Rayat Shikshan Sanstha's online learning program. Today my lesson is Revolutionary Steps in Surgery Part 2. Revolutionary steps in surgery means drastic change which has taken place in surgery. Surgery which means operation, medical operation. So Harvey Cushing is considered to be the father of modern neurological surgery. In the early part of the 20th century, he developed basic techniques and instruments for operating on the brain as a distinct surgical specialty. Cushing dramatically reduced the mortality rate for neurosurgery from 90% to less than 10%. By the time of his retirement in 1937, he had successfully removed more than 200 tumors. So here it is told about Harvey Cushing that he was known as the father of modern neurological surgery. Neurological means of the brain. So in the early part of the 20th century, he developed some techniques for operating on the brain, and because of that the mortality rate, the death rate came down to 10% from 90%. And when he retired in the year 1937, he had successfully removed more than 2000 tumors. Tumors are abnormal growth in the body. The main reason that mortality rates had been so high before was blood loss. Because of the blood loss during these operation, that people used to die. Among Cushing's significant achievements are the methods he developed to stem this blood loss by inventing a clip called silver clip or the Cushing clip. So in order to prevent the blood loss, he developed a stem. He developed a system, to stop this blood loss by he invented a clip which is called as the silver clip or the Cushing clip. Thus, neurosurgery is one of the most cutting edges in the world of surgery and medicine. Neurosurgery is very important. It is the latest technology in the world of surgery and medicines. What is robotic surgery? So now we come to robotic surgery. Robotic surgery is a type of minimally invasive surgery. Minimally invasive means the operation, that when the operation is done, the doctors, they don't make huge cuts. The cuts are made through small surgical instruments that fit through a series of quarter-inch incisions. So these instruments, they are very small and they fit through a small cut. So when performing a surgery with the Da Vinci, the world's most advanced surgical robot, these miniaturized instruments are mounted on the 3 separate robotic arms. So this because these surgeries are done through robots, so these instruments are placed on the robotic arms, allowing the surgeon maximum range of motion and precision. So because the instruments are placed on the robotic arms, the doctor, he can move, he can do his work well. The Da Vinci's 4th arm contains a magnified high-definition 3D camera that guides the surgeon during the procedure. And the 4th arm of this robot, it has the 3D camera, and this he guides the surgeon during the process of the operation. So this the surgeon, he controls these instruments and the camera from a console. Console is the room where this device is controlled, and he places his fingers into the master control. He controls it, and then he operates all the four arms of the Da Vinci. Da Vinci is, I had told you, the robot. While looking through a stereoscopic high-definition monitor, the robot literally places the surgeon inside the patient. So because of this, the high-definition monitor, it looks like as if the doctor is inside the patient, and because of this, he has a better, this gives him a better detailed view, so he can see the operating site very clearly, okay, than the human eye can see. Every movement he makes with the master controls is replicated accurately by the robot. Whatever he does, the robot does it same way. When necessary, the surgeon can even change the scale of the robot's movement. So even when the doctor doesn't want, he can change the movement of the robot also. If he selects a 3:1 scale, the tip of the robot's arms will move just 1 inch for every 3 inches that surgeon's hands move. So what these lines means is that the surgeon he has control over the movement of the robot. So because of this advanced technology, our doctors now are able to perform complex they can operate complicated cases also. Since these procedures can now be performed through very small incisions, now these operations can be performed through very small cuts. Our patients experience a number of benefits compared to the open surgery of the past. So because of this, because of all these developments, even the patients now, they don't have much, they don't have to things have become easier for them, okay, unlike the past. In the past, things were very painful. They were limited, the technology was also limited, but with all these advanced technology, even for the patients also, it has become very easy. So with this, I have ended with this lesson. Please read the lesson, go through the textbook, look for the meanings, and then try to answer the question. This is a very important lesson, so please go through the text and try to answer the questions. Okay, thank you.